everyone, welcome back to my channel and you're watching The Brown Feminist. And in today's episode, I'm going to be telling you guys 10 ideas for side hustles if you work your full-time job in clinical research. So without further ado, let's get into it. Now, in this day and age, we can't really all have just one day job. As sad as it is, millennials and Gen Zs have figured out the piece to financial solvency and security. And that is to have one solid day job supplemented by another side hustle. So a side hustle can look different for everybody. And there are a lot of general side hustles that almost anyone can partake in. For example, anyone from any industry or set of skills, as long as they can drive, can do things like delivering for Uber Eats or SkipTheDishes or just driving for Uber or LYFT. However, if you do have industry-specific experience, then if you can find the right side hustle, you can actually make more than just minimum wage or a lower fee that is open to the whole population. So how do you do that? You need to really understand the skills and experiences you have gained through your main education or your main day job skills. And by using them, you can make yourself more appealing so that your side hustle can be making a lot more money than the general side hustles that are available for everybody. So here are my top 10 side hustles if you have a day job in clinical research. So if your day job is like working as a research assistant full-time somewhere, you can do the exact same thing part-time. So my number one side hustle is being a research assistant somewhere that's casual and part-time. Now the challenge here is to find a project that is drastically different from the one you're working on, because otherwise there will be an issue of conflict of interest if you're working on more than one project. Once you have the right fit and it's got flexible hours, you can definitely speak to your supervisor or your HR to let them know that on your off hours on the weekends, you're helping out on another study for a few hours a week, and this is what the study is about, so there is no conflict of interest. As long as you are performing well in your day job, they shouldn't have an issue with you doing a few more hours somewhere else. But honestly, this is the only kind of side hustle where you actually even have to inform your supervisor that you're doing something else out of work hours. And the reason is because you want to be very clear on the ethics of it, that you're not going to work on two competing projects, or there's not going to be conflict of interest because of the nature of the project that you're working on. This can be a little challenging if you have a particular research niche that you've specialized in. But if you are in a more junior level as a clinical researcher, you still be able to transition your various skills like your research, data collection, analysis, patient consenting, all of that, from one completely different disease model to a completely different kind of physiological issue, right? So that was my number one, which is to work as a part-time or casual research assistant on a different research project. Number two is to work as a tutor or as a teaching assistant. So if you are currently affiliated with a master's program or a PhD program, you can always get an additional kind of teaching assistant position. You can also just tutor anyone from high school to university as long as you have the academic training for it. Having a strong background in research means you're in a particular position to train people on those research methods courses, those statistical analysis courses, all of these things that students in both high school and post-secondary often suffer from because they need a little bit of additional help. You can use lots of different platforms that are available these days and websites in order to market yourself as a tutor who specializes in either a kind of biology, particular disease models, or just research methods and statistics and other things. So you can always tutor in general, you can always find your own tutoring people and students, or you can also kind of try to affiliate yourself with a university where you're maybe in an education program and see if there are teaching assistantships that you can do. Number three is to work as a data entry clerk. Now, if you are working in clinical research, that means you have definitely had the opportunity to do a lot of data entry work, right? You're probably an expert in things like Excel and SPSS or other kinds of data entry performance, where you might have to extract data, clean data, input data, and so on. So there are actually a lot of jobs available for data entry clerks for different industries. It doesn't even have to be medically or clinically related. As long as you have that skill, you can go ahead and do that same skill of where maybe you're given a huge bunch of documents, find these information and input them, find them and input them. It can be tedious work, but sometimes not having to think too much about it and just doing something more monotonously can be refreshing in your side hustle, because you are giving more of your intellect in your day job, and your side hustle can be a little bit more monotonous. Okay, gotta take it from here and input it here, and that's it. So data entry clerk was a good side hustle at number 3. Number 4 is to work as a medical writer. Now this is an excellent side hustle because you would by now already have done some kind of a bachelor's degree, maybe even a master's degree, and you have that solid background in medical terminology. And that is exactly what medical writers have to have, along with the ability to write very well, to make appealing kind of writing that is open to a scientific community as well as a general audience. So there's lots of websites, there's lots of companies who are always hiring for medical writers who have a background on things like these, who have experience in the clinical world, who've worked with medical professionals, but who also know how to talk to a general non-medical patient just like you. So if you have these skills and you think your ability to write and summarize things in simple ways and explain science to a lay audience is really good, then this might be the job for you. So don't forget to go on your job site and look up positions as a medical writer. A lot of these positions are remote, a lot of them are part-time, some are even casual. Now, number 5 is to work as a grant writer. So of course, if you've been in clinical research long enough and you've done some of these projects where you yourself had to work and supporting your supervisor in writing a grant and getting the money for the project, then you know exactly what grant writing is and how to get it done, right? So as you know, grant writing requires a lot of assessment first if that grant is right for you and your project and your organization. Secondly, you obviously have to develop all of the documentation, the protocols, the supporting materials to show the grant that yes, we actually deserve to study this further. This topic needs more investigation and we have the right team to be doing that investigation, and we can deliver good results and we have the infrastructure in place. So guess what? Grant writers are actually highly sought after, especially if in your past research work, you've already won a few grants or you've applied to a bunch of very complex grants, very expensive grants, and you've won some of them. Then highlighting that in your resume and applying to grant writer positions can be very helpful. Once again, similar to being a data entry clerk, as a grant writer, you can be desired candidate for people outside the clinical and medical world as well. There are lots of nonprofits and other smaller organizations who can also hire you for short-term temporary contracts to write their annual grants. You would have to go in, take the time to study the organization, what it has to offer, what kind of grants they're looking for, whether they're research grants or non-research grants, and soon enough you can have a rich portfolio of grant writing, whether that is research related or not. Of course, the transition to moving from being a clinical researcher to having a side hustle to write other research grants is of course going to be easier than writing non-research grants. If you want to learn more about it, do let me know in the comments down below and I'll explain more in another video. Number 6 is to work as a nurse in a hospital. Now this point assumes that you have a registered nurse's license and you are working as a research nurse in the world of clinical research. Now, if that is true, then an excellent way to keep your license activated in your state or province, and also to keep making some good money, is to be affiliated with a hospital or long-term care as a casual part-time nurse, right? Every now and then, maybe once a month, maybe twice a month, you can pick up a night shift or you can pick up a weekend shift or a holiday shift and just get that little bit of extra money coming in as a good side hustle. The best part of this is that as an RN with years of seniority, you of course have a good rate of pay per hour. Unlike if you were going out and doing more general side hustles like Uber, you would be paid at a much lower rate. So the fact that you're able to utilize some of those skills and qualifications you hold from before is helping you to get a much better rate of pay. Number 7 is to work as a college instructor or a university lecturer. Now, depending on how far you've studied, you would usually need to have at least a master's degree, if not a PhD. But even though your day job is in clinical research, you can be affiliated with educational institute. You can be an instructor at college for many kind of technical programs. You can be a lecturer, an entry level like lecturer or assistant professor at a university, as long as you're like an adjunct position. You can be cross appointed. There's a lot more to explore there, but yes, a little bit more educational and academic qualifications are required for this position. Number 8 is to work as a scribe. Now, those of you who don't know what a scribe is basically a person who has a lot of knowledge of medical terminology and is able to type very fast and verbalize and write down things in a very clean and meaningful way when they're hearing it and as it's actively happening. Most scribes that I've known of who are medical scribes work basically affiliated with a physician, either in a hospital or a doctor's clinic. And when physicians do like a lot of audio recording and like transcripting, needs to be done after that. So because physicians don't always have the time to take down like long bits of notes, they do audio recordings, and a scribe's job is to transcribe that audio recording into like a nice written format. Now, in order to do that, you obviously will need to know like the right spelling and the right words, because some of these medical terms are very complex. And that is exactly where your niche comes in. Your training, your exposure to clinical research, your understanding of medical terminology, your ability to write really fast and listen and understand what he was saying in that exact moment. All of these come in and you can work as a medical scribe for various organizations. Now, number 9 is to work as a consultant for various pharma or health tech companies. Now, a lot of health tech companies are now requiring more like input from people who have a medical professional background. So whether you're a registered nurse or whether you're working full-time in clinical research, it's worth a shot to try out and see if there's any health tech companies near you who want to know a little bit more about the typical environment in like a clinic or in like a clinical research, a clinical trial, because they might be developing an app or a software, some kind of a system, in order to support people in these roles in the future. And they need to kind of know what the current challenges are, what the main issues are. But once again, just like we talked about a few other roles like a part-time research assistant, this is very like overlapping with your responsibilities. So it is good to let your supervisor know that you will be working and consulting on them, and there shouldn't be any conflict of interest. Anything you say will be very generalized. Obviously, no like private medical information or even like business information will not be leaked. Only like very general understanding and challenges will be shared with this organization. Number 10 is actually super fun and interesting. It is to work as a technical recruiter for other research programs in your field who are trying to hire a clinical research coordinator or a project manager with all of these experiences. Chances are, if you've been working in this industry for long enough, you've actually had a good network of people. You know lots of people, you network with them, you know where to find more people, maybe fresh grads or maybe experienced people to be headhunted. You also have a good profile on LinkedIn where you are constantly meeting new people in your field. So by using all of that network and all of that exposure to that industry, and the fact that you can like really understand what each position requires, okay, this person wants a clinical research coordinator who also has a nursing license. That person wants a research assistant who also knows data management or this kind of like analytical software. Okay, so you know what these terms mean. So for you to actually go around and work as a part-time recruiter, a technical recruiter, a talent acquisition specialist, and hire from those roles is going to be a lot easier than somebody who doesn't really have that kind of exposure from this industry. So number 10 was to work as a technical recruiter to help other people hire clinical researchers like you. So there we have it. These were my 10 side hustle recommendations if you're working your day job in clinical research. I really hope you found this video to be very useful. If you did, or if you have more ideas that you think I've missed, then please do comment down below and let me know in the comment section. If you would like to see more content like this, don't forget to hit subscribe. My channel does specialize in the world of clinical research. Until next time, this is the Brown Feminist. Bye.